Well, as we've seen, increases in cases continue to grow, and that's causing concern for Arizona hospitals, worried that they'll be overwhelmed. So we just got the latest numbers, again repeating 4,417 new cases, and sadly 43 more people here in the state of Arizona have died. So Ernie is now talking with Dr. Cara Christ, the director of the state health department. Good morning, Ernie.
Good morning, Javier. Like you mentioned, we just got those new numbers, so we want to jump right in and toss it over to Dr. Cara Christ. Dr. Christ, just give us an idea of where the numbers stand right now.
So today we added almost 4,500 cases and 43 deaths to our numbers. So these are concerning increases that we're monitoring here at the department on a daily basis.
We wanted to touch base with you regarding schools. We are seeing a lot more schools close down or return back to online learning. But yesterday you said there's really no evidence that COVID is spreading in schools, but there seems to be a little bit of a discrepancy between what these school dashboards are saying and what Maricopa County is saying. So what plan is actually in place to make sure there's an accurate count of these cases?
So the schools and the counties, we're talking about talking about the same numbers, just applying the principles differently. So kids are coming down with COVID-19. What we're identifying is that spread is not happening inside the classroom. It's either happening at events after the class, at practice, at extracurricular activities, when they're hanging out with their friends, or family gatherings. So it's not the danger of being in the classroom that's causing the spread of COVID-19.
So it is the danger of it spreading amongst kids, but it's the location in which they are contracting it.
Right. We're not identifying that it's being spread prevalently through classrooms.
Another question in regards to schools. We're hearing from the Arizona School Board Association, many school board members who are really just crying out for more training, help, and just guidance from the state on when to make these informed decisions about closing schools. What can you say to those people who are really saying they're unprepared and not trained to make these health decisions?
So in August, we released the benchmarks, which put metrics for when schools should consider different types of learning options. So in substantial, we would recommend that they be in a virtual. Currently, the entire state is in a moderate transmission category, which we recommend being in hybrid, providing an off-site learning for those kids or families that may be high risk, but providing in-person learning for kids that want to be in the classroom. What we would recommend if school boards are looking at whether they need to go virtual or go hybrid, we recommend that they reach out to their local public health departments, their county health departments, to talk through. They will provide technical assistance and make recommendations based on the very specific community data that they are seeing.
And lastly, we know that masks are required in businesses, establishments, and several cities and counties, but not statewide. What advice would you have to people out there who still are not privy or do not want to wear a mask, especially as we have these new case numbers and the holiday season coming up?
So we are seeing a concerning increase in cases and percent positivity, which is community transmission. We encourage every Arizonan to wear a mask whenever they are outside of their house, and even in your house if you have people that don't live with you. However, 100% of Arizona does have some type of mask mandate, whether it's a county mandate, a city mandate, or the mandates that ADHS have put on all restaurants, gyms, nightclubs, bars, movie theaters, water parks, schools, hair salons. So pretty much anywhere where you're going to go congregate with somebody, there is a mask requirement statewide.
Anything else that you'd like to share with our audience this morning?
We would just say, as the Thanksgiving holiday comes up, please make sure that you're making plans. We don't want to continue to see these increases, and we are seeing spread among small household gatherings. So wear a mask if you are with people that you don't normally live with. Make sure you're physically distancing. If you have a high-risk condition, elderly, or you have symptoms, celebrate virtually with your loved ones this year.
All right. Thank you, Dr. Christ. And we'll send it back to you in the studio, guys.